Dr. Faisal Refaei. I'm the Director of Clinical Services at the Disman Diabetes Institute. So in general, diabetes is a chronic condition, i.e. if you get diagnosed with diabetes, you live with it for life. There are three different types of diabetes: type 1, type 2, and gestational diabetes. Type 1 affects about 10% of people worldwide, and type 2 about 90%. And the gestational type is the one which actually affects pregnant women. All the types of diabetes, what happens in the body is basically either the body doesn't generate enough insulin, which is a hormone that converts sugar in the blood into energy that is used by the cells. So either there's not enough insulin, or there is insulin but it's not used by the cells appropriately, or the cells are resisting that insulin and they don't use it at all. So that's how the diabetes comes about. So in our experience with dealing with the illness, because it's a chronic condition and it can affect multiple systems and organs in the body, it needs a multidisciplinary team approach. So it's not only talking about a doctor, but we need an educator to be on board that educates the patients. We need a nutritionist so that people with diabetes know how to eat better and healthier. We also need someone that takes care of the patient's eyes, because usually they get affected pretty quickly with the diabetes. We need someone who takes care of the patient's foot as well, because that's one of the areas which gets affected as well. And we need a really good pharmacist that guides the patient on the best options for medication. So when we talk about numbers, in Kuwait the percentage is about 20% prevalence, i.e. there's about 20% of people in Kuwait that are affected by diabetes. And now we're talking about type 2, which is again 90% of cases, and that's in the adult population. So basically 1 in 5 people in Kuwait has diabetes. The worldwide average is probably between 7 and 10%, and there are about 400 million people affected with diabetes worldwide. When it comes to the difference between male and female, there's no preference in terms of the disease. So male and it can happen to males and females almost equally. So socially, diabetes affects the patients in multiple ways. One, because they need to take medications on a regular basis. Some need to take injections of insulin, and so it affects their social interaction. They feel quite aware of when they need to take the injection, how they take it, can they do that in public or not. Of course, there's a restriction towards social activity that has to be managed by the patient in terms of eating, how much you eat, what you can eat. And in terms of physical activity as well, particularly for patients who are on insulin. They need to really gauge these things appropriately and manage them. So that's how it affects the patient in a social way, although patients can live a completely normal, healthy social life if they understand how to manage the illness appropriately. But it affects them in multiple ways. And of course, the other reason is it's a chronic condition, so it's not going away, so you have to deal with it through potentially early age, later age, and old age. But also from another aspect, it affects the family. So a person with diabetes, the way he eats, the way he functions, etc., may affect the rest of the family. We usually think that is actually potentially a positive impact, whereby the patient or the person with diabetes starts to focus on healthier eating habits, exercising appropriately, and living a healthier lifestyle, and that should then have a positive impact on the family in general. So the Disman Diabetes Institute focuses on actually research and not the treatment of people with diabetes particularly. So while we have a part of what we do that treats patients, the purpose really is to look at complicated cases of diabetes which require more effort and a multidisciplinary approach that's available here at the Institute, and also to engage these patients into research that potentially can help many people with diabetes either find the origins of the disease and how we can manage it from its roots, or find ways of preventing the disease from happening in the first place, or different ways of managing it. So because there's a high percentage of diabetes in Kuwait, it lets us ask the question of, can we actually prevent diabetes and what's causing it, And the answers are quite simple in most cases. So it's the lifestyle that we actually choose to live. So a lifestyle that lacks regular exercise, does not include healthy eating habits, and where there is obesity, an increase in weight on a long-standing time, is really what causes type 2 diabetes, which constitute the most or the highest percentage of diabetes cases. So in essence, the advice then becomes, because of all these reasons, the advice is to eat healthier, exercise regularly, at least half an hour every day or every other day, and to maintain a healthy weight. In addition, because the percentages are so high, we always encourage everyone to test the simple finger prick test, just to see whether they actually have diabetes or maybe have pre-diabetes, which is what happens before you get to the stage of diabetes, at least once or twice a year.